Normally the family can tell when someone's not being treated properly. There's different types of nursing home abuse. There's what I'll call neglect, which is patients who aren't being treated properly, they're not being observed properly. They often develop things like bed sores if they're not being moved as often as they should be.
They are supposed to be turned every 2 hours or hour to different parts of their body, because when they're on their back at all times, that's when they get bed sores.
Or they'll have nutritional problems, whether maybe they're not being fed as carefully as they should be.
Because if they're not able to speak, sometimes they don't get the food they need, and sometimes they don't get the liquids that they need. A lot of times you see in nursing home cases where the client, all of a sudden they're rushed to the hospital because of dehydration.
But there's other types of problems that often occur at nursing homes. Like, for example, let's say you have a patient in a nursing home who is not independently ambulatory. So they need help going to the bathroom, or they need help getting up to be fed, or anytime they need to go anywhere, they need help, and no help comes. And at some point in time, they try to go on their own, and sometimes they fall, or they have accidents, things like that. So that's a type of supervision that the nursing home has to provide as well, and they don't always do that.
All these things combined together, you just have a situation that's ripe for this to happen, and not only to happen, but to happen frequently, constantly. And it leads to tragic situations, many of which never ever come to light. Many of which, truthfully, end in the death of the victim and no one being the better informed for what happened.
When a relative of a patient in a nursing home comes in who was neglected, they usually feel very guilty that they didn't do enough, or they could have done more, or they should have seen something. And
a lot of times you'll find that the nursing homes will try to blame or point the finger at the victim. But the fact of the matter is they are required to properly and adequately care for the patients that are there with the ailments that they come in with.
And unfortunately, you have individuals who for some reason are incapable of dealing with the situation in a nursing home. Oftentimes the work is maybe not very pleasant, and you have people who, if the work doesn't get done, are not in a position to complain. If there's any complaining by the victim, well, then you'll have emotional abuse and physical abuse tied in as well.
with nursing home, it gets a little tricky with statute of limitations. Why, as soon as you feel you might have a case, you should call the lawyer. It's just a phone call. We don't charge unless we take the case, and then it's on a contingency fee basis, which means we don't charge unless we recover something for you.
As a matter of fact, over the course of the case, it'll cost you nothing. Our fee is only a portion of whatever it is that we can recover for you. So if we don't recover anything, we don't get a fee.